Hey y'all, Dr. J here, your friendly neighborhood medical marijuana doctor. Today we are finishing up on tetrahydrocannabivarin, or THCV. We will talk about its actions not at the CB1 and CB2 receptors, but the limited data we have so far on its actions at other receptors. Before we start, I just want to give a disclaimer that THCV is another prime example of the stark lack of research, despite the pretty amazing and widespread potential therapeutic benefits of cannabinoids such as this. It is known that THCV agonizes TRPV1 and V2, as well as TRPA or ankyrin channels, and as I've talked about in previous videos, those channels are involved in quite a wide assortment of things, but chiefly neurogenic or neuropathic pain, and they're on a lot of sensory neurons, and so they desensitize those channels, which then leads to reduction in pain. There was one placebo-controlled human clinical trial, however, that gave patients with type 2 diabetes doses of 5 milligrams twice a day for 13 weeks. And although there was no change in plasma inflammatory markers like IL-6, tumor necrosis factor alpha, or CRP, C-reactive protein, it did show in these patients a reduction in fasting plasma glucose or blood sugar and improvement in the function of their native insulin-producing beta cells. We're just hypothesizing at this point at what receptors THCV could bind to lead to results like a reduction in fasting plasma glucose or improvement in the function of insulin-producing beta cells. And lastly, not as an example to say that THCV should be used clinically for this reason, but an example of the real need for further research for potential therapeutic benefit is that in one study, THCV did show an activation of the serotonin 5-HT1A receptors, which has the potential to produce antipsychotic effects.